Hi everyone, my name is Adnan, and today we are gonna study ischemic heart disease manifestations. So, again, I would say that if you only know the meaning of the words of the topic that you are gonna study, half of the job is done. So, ischemic heart disease, ischemic. It means there is gonna be ischemia. You know what is ischemia? When there is no proper blood supply to a tissue, there is gonna be ischemia. So ischemic heart disease, when there is no blood supply to the heart, right, there is gonna be this problem, ischemic heart disease. Okay, now there are three types of manifestations of ischemic heart disease. You got the heart, right, and you got the blood supply to the heart, and if through the coronary blood vessels, and if the blood vessels are blocked by an atherosclerotic plaque, if the blood vessels are blocked and the enough blood is not reaching the heart, and maybe your patient is exercising, during exercise you need more amount of blood to the heart. Why? Because your heart is pumping more to deliver more blood to the peripheral tissues, right? So heart needs more oxygen while exercise. So if there is an atherosclerotic plaque, it's gonna limit the amount of blood that could be increased to the heart. Okay, and that is gonna cause less blood supply to the heart. The demand is more, and when the supply is less and demand is more, the tissue which was actually craving for blood, craving for oxygen, it's gonna like die. Okay, that is ischemia. Like your that tissue, your that particular cell was craving for lot of oxygen, lot of nutrition, because it was like having lot of activity, but you could not supply that. That tissue will die due to imbalance between supply and demand. Now we have certain types of ischemic heart disease manifestations. As you can see, stable angina, unstable angina, and vasospastic angina. If you see this picture, this is the normal coronary artery, and this is the normal laminar flow through the coronary artery. When a person is exercising, a normal patient, for example me, when I will be exercising, the amount of blood to my heart can be easily increased, right? There is no atherosclerotic plaque. But imagine a diabetic person who is also hypertensive, who is also obese, his BMI is high, he's having so many risk factors for atherosclerotic plaque to develop. So there is an atherosclerotic plaque in the coronary artery. Now imagine there is a heart here, and this guy just started exercise, and during exercise heart is gonna contract more, it's gonna crave for more oxygen, and now the heart, if there is an atherosclerotic plaque, it will limit the amount of blood that could be supplied to this heart, right? And then there will be ischemia, and that one will be manifested as pain over the chest. Heart is located in the chest, and then the pain is like referred to that area where the specific dermatome that through the nerve, specific nerve which are supplying that area. So your patient is gonna manifest, the ischemic heart disease is gonna manifest as chest pain in this guy. It is also gonna manifest as chest pain in this guy. Unstable angina, you see, there is an atherosclerotic plaque, and if this plaque ruptures, okay, and this plaque ruptures and there is an occlusion, but that occlusion is not complete, blood can still pass through here, that is unstable angina, right? And atherosclerosis with blood clot, right? This is simple atherosclerosis, so it is stable angina. The pain is gonna be there, but when the patient is like not exercising, on rest, the heart demand and supply will be matched by this like amount of blood flow. But this guy who's having unstable angina, his plaque just ruptured. Okay, this plaque ruptured, the lipids were released, they are thrombogenic, there is a clot formation, and that is limiting the amount of blood which could be supplied to the heart. So this angina is not relieved by rest. When the guy will be on rest after exercise, the pain will still be there because the blood supply to the heart is still blocked, right? And you should be able to like differentiate this unstable angina from myocardial infarction. In myocardial infarction, there is a two types, STEMI and NSTEMI. In STEMI, there is a rupture, and that leads to clot formation, that leads to entire blockage, right? And you get that ST elevation myocardial infarction. But in NSTEMI, there is rupture, there is clot formation, but not complete block, blood can still go, that can lead to non-ST elevation myocardial infarction. Okay, this one will not be relieved on rest, and this pain will be relieved on rest. And then there is this vasospastic angina, where the blood vessels are undergoing spasm, and that one is limiting the amount of blood to the heart, and that one is again leading to chest pain. And this spasm could be due to cocaine, due to stress. Lot of factors are there. Okay, so you see, ischemic heart disease is manifesting as chest pain, but the pathophysiology involved behind each manifestation is different. So if it is relieved by rest, it's gonna be angina. If it is not relieved by rest, it's gonna be unstable angina or myocardial infarction. How are you gonna differentiate between two of them? You are gonna differentiate between two of them on the basis of the cardiac markers, which will be relieved, which will be elevated in case of infarction, but not in case of just simple angina. Okay, so you are going to differentiate between those two manifestations on the basis of this. Okay, so you see here, in the STEMI, you got the basically full infarct, okay, transmural infarct, and that one is leading to ST elevation. So you got the P wave, you got the QRS, and then you got the T wave. Okay, this is the normal ECG curve. But in case of this guy who's having transmural infarct, full blood supply blocked, this part is gonna be elevated on ECG, and this is a very evident ECG, and you should be able to like differentiate this one from the normal one. Okay, at least as a medical student, when you go to the wards, this is the simplest ECG, and you should never fuck up with this ECG. Okay, and this one is subendocardial infarct, and this one is due to blood vessel, there was atherosclerotic plaque that ruptured, there is thrombosis but not full blockade. Okay, so subendocardial infarct here but complete infarct here. Okay, so this one is leading to ST elevation, and this one is leading to ST depression. So these are the ECG changes in the NSTEMI and STEMI.